Good afternoon. You're watching Restart, a 10-part podcast and webinar series. And today we are going to be talking about dentistry. Well, I'm going to be honest with you right now. I don't know much about the industry as such, except how the thought of going to the dentist would scare the daylights out of you. However, now looks like there's a little virus doing the rounds that's scaring the daylights out of all dental practitioners across the world. The effects of the pandemic have forced many dentists to drastically alter or temporarily close their practices. Leaders from the industry have had to wade through social distancing requirements, new special equipment needs, paycheck protection program loans, and even employee furloughs. But is this the end of dentistry as we know it? Well, to find out, we have Dr. Majid Al Maliki, Dr. Mohammed Naji, and Dr. Layal Siabi joining us today. Hey, thanks so much for being here with us. I think I was muted for the first part a little bit. I hope all of you all heard the introductions. But let me come to all of you one by one at this point. Given the pandemic, given the current situation we are in right now, help us highlight the opportunities that you have seen in the situation. Because again, start is all about kickstarting businesses and telling us the path forward, the way forward. Dr. Layal, I'll start with you first. If you can tell me a little more about yourself and then go into the question that I just asked.
All right, thanks Shruti for this opportunity. Nice to meet you all. Just before I get started, I'll give a little bit of background about myself. I'm a Canadian-trained general cosmetic dentist that have been practicing in Montreal for a while, and I moved to Dubai about a year and a half ago. And I've been practicing in Dubai as an escape to get away from the cold weather, let's say, in Canada. And I'm really glad to be on this show. So just to go over your question regarding the opportunities for reform, given the post-pandemic era we're in right now, for sure, I find COVID-19 has highlighted a lot of issues that dentistry has been facing for some time, and these are issues that I really think they need to be tackled. And one of them is that I find there is a little bit of a shortage on the emphasis. We don't really emphasize on prevention in dental care. Dentistry tends to be more of a treatment-centered service rather than prevention. So I really think that COVID-19 definitely highlighted this, given that access to care has been quite difficult. At the peak of the pandemic. So this is definitely something that we should look at.
Sure. Coming to you now, Dr. Mohammed. So do you think there is sort of a need for reform in this industry, and there always has been a need for reform? Probably COVID-19 and the situation we see right now has just accelerated or sort of pushed it?
I didn't get your question, sorry.
I was asking if you think there is a need for reform in the industry per se. Has this situation right now sort of accelerated the need for that reform or revolution or evolution of the industry?
Yeah. Actually, when it comes to the practice, let's put the business aspect aside. We'll get to that definitely. But when it comes to the practice, I've been seeing something that I think dentists now must get used to the old norms, of the practice, not the new norms. Everyone is talking about the new norms now, but let's face it, when we went to dental school, all of the hygiene standards, all of the precautions we were taking back then were the COVID-19 precautions that we're doing now. The only thing is that we're bringing them back into action at the moment. So when it comes to the practice itself, yes, we were in danger. We're one of the industries that got really affected. But I believe just taking the right precautions and going back to the origin of infection control when it comes to our practice, the critical points of infection control, I think we can manage well. And if you mean by reform as in those kinds of precautions, then I think that would be safe enough for the practitioner along with the patients as well.
Interesting. Dr. Majid, coming to you now. First, if you can tell us a little bit about what you do, and then let's talk about the sort of changes that you have seen both in Boston and in Dubai since the break of the pandemic.
Again, my name is Dr. Majid Al Maliki. I'm a practicing dentist in downtown Boston. We have Boston Dental here. It's 2 and now 3 offices in the downtown area. I work in Dubai as well at Dr. Duval's office in Jumeirah. I was in Dubai in March when all this started to, occur and the crisis started to happen, because this is truly crisis. So I was helping and working with my team here in Boston from remote, but we had to close. All dental offices had to close. We closed here to regular dentistry, but we had to be available for emergencies, and we always were. And for 2.5 months, we had to start researching what is it we need to do. Like Dr. Muhammad was saying, in dentistry, all dentists do awesome with the blood-borne pathogens, I would say. But when we come to this virus, it put an emphasis on other types of pathogens. This is the airborne pathogens that we started to face and have to find proper solutions so we can handle it. From starting to put bigger emphasis on PPEs, the air quality in the practices, and what is it you can do to control the air quality, the air that we breathe. And the World Health Organization many times showed some studies that said that this virus is airborne. So now what is it that we can do? And in dentistry in general, aerosols is the biggest factor. And that's commonly available in any dental practice. So aerosols are carrying this as well, and then it's airborne. So we had to find solutions to this issue, and we had to work on the air environment in particular.
Of course, but there's just this one sentiment that I've gotten, right? So I put up this post, the promotions that we had going on for this particular segment. One common theme around it was, yes, it could be the end of dentistry as we know it, because now people are considering or going to the hospitals for slightly more important, I don't want to say important, but basically more graver issues with regards to their bodies. So with that sort of sentiment that people have right now, in order to go to the hospitals just for certain needs and just for the grave issues, Dr. Layal, what would you say?
I think that really open communication and getting the right message out there to gain the trust of patients to come see you at your private practice is the best thing we can do right now. Because I don't think it's right for dental patients to go to hospitals for dental care. Already the entire hospital is kind of overburdened, with everything else that's going on. So I really think that we need, as dentists, to get a little bit more creative in our marketing strategies, or not necessarily marketing, but in trying to communicate better with the patient, try to get their trust more, and get creative in terms of reaching the patients. I mean, one aspect which I'm assuming we're going to be talking about later is about teledentistry. And I really believe that teledentistry can definitely lessen the burden on hospitals.
Sure. So while talking about teledentistry, there's one more thing that I would like to ask you. Do you think at this point teledentistry can help reduce inequalities in dental access, if not in Dubai, in other parts of the world, Dr. Mohammed?
Yeah, it definitely, I mean, we've been using this for a while, ever since COVID started, but that was the plan initially before the COVID. We always wanted to initiate this technology to, at least do consultations online, because first of all, it broadens your market. You can reach out to all the patients from all around the world. Second of all, for us, we have living in a cosmopolitan city like Dubai, you have all kinds of nationalities coming to the city. So almost 52% of our patients usually came from out of town before the COVID-19 issue. So we always thought of the online consultation, not just because of the current situation, but to facilitate their visit to you. A lot of patients would want to come from abroad or any part of the city to get treatment, but they don't know what is the issue, can they afford it? Is it worth visiting the dentist or not? Because a lot of things can sometimes get treated by a prescription, Although I would like to emphasize on the fact that we cannot give a very accurate consultation or diagnosis online, because the patient has to take the photos and the x-rays from the nearest dental practice if possible. But let's face it, for us, out of experience, it did facilitate a lot of our procedures. We've had a lot of patients in Dubai, like not even abroad, doing their online consultations, we can either solve their problem with like a simple prescription, if possible, of course, if it was clear enough. And a lot of them would come ready for the treatment immediately. We won't have to waste time on, getting to meet the patient, knowing his chief complaint and the diagnosis and etc. So whether in the corona phase or after that, I think it's a very useful tool.
Well, I think that answers the second part of the question that I had with the advent of telemedicine and the adoption of it on a more wider scale. Do you think hospitals or dental clinics are going to have to shut, or probably there are not going to be dental clinics in the future? What do you think, Dr. Mohammed?
Of course not. I always said COVID-19 did not kill or cancel the dental market. What it did, we did not lose revenue. What happened is we had revenue deferral, which means, look, every other market, for example, if you had a restaurant, if you're a taxi driver, you lost the client during the COVID-19, because if you had that meal, you already cooked it at home. That haircut, you already did it at home. So they lost their revenue. For us, it's just deferral. It's a matter of postponing your revenue, which means that filling still had to get done after the lockdown is over. So for us, it was just a matter of time. But losing the market, or is it the end of dentistry? I don't think that would ever happen. It's pain, COVID or not, they will call you up and come into the clinic. So no, I don't think yes, it affected us, but it wouldn't kill us.
On that note, then, Dr. Majid, do you know how many or have many major dental clinics experienced huge losses or irrecoverable losses in just the last few months?
Shruti, we had to close for that pandemic period for about 10 weeks, I think. I think it's around the same time for Dubai as well. So like Mohammed was saying, at that time, we were just doing tele-dentistry. We were doing and helping people with virtual consults as well. We were attending to their emergencies, and we are trying to defer dental work to later because we needed time to understand what's going on, the virus, how it's spreading, what is it we are doing to people in a dental environment, and how we can step up the dental environment. So now all this work and the disease, unfortunately, we see it, like Mohammed said, a lot of patients here in particular, they come for their regular semi-annual checkup and cleaning. A lot of patients now are emailing us and saying, I really need to come, my gums are starting to bleed, and so on. So what we saw with that interruption in access to care, the 3 months interruption, we saw that the disease got worsened a little bit. Now, a lot of things are reversible, and that person comes and he gets a good cleaning and go back to good oral hygiene, and then his gums will go back to normal. Some decayed teeth, now they were, needed to be handled with a restoration. Now it requires a little bit more work. So the main factor was for these offices, dental offices, to step up their game and to show what is it they can do to control that virus and to try to limit the spread of a virus. If we don't say, prevent the spread of the virus altogether in a dental environment. When you show this, and like Layal said, communication with patients, we were emailing all our patients periodically, showing them what is it we did at the office, what we did with the air conditioning and the filtration and the UVC disinfection to the air conditioning units, then, the deployment of these 2 robots, the UVC robots that we brought from the Denmark to the office. We are always communicating with our patients and of course the staff as well, so they see what is it we did in a dental office, so we can step up the game, so we can be very solid on prevention and not assist in spreading the situation that we have. So these 3 months, yes, they hit us for business wise, they affected us in terms of revenue for 3 months, but everything is back to normal now, at least, at our office. And from what I see, a lot of other dental offices are at least 50, 60, 70% back to normal. Next year, everybody will be back to normal. It's just what is it we learned from this situation so we can apply to the future as well.
Sure. then, Dr. Layal, can I ask you about the major safety measures that were put in place? You said your clinic, your hospital never shut down, even during the COVID times and, when there was a lockdown. So what were the major measures that were taken?
I mean, for sure, the dental office, they have to be reorganized. There are definitely new safety precautions and protocols that have to be implemented. But just remember, I mean, dentistry has always been amazing at infection control. We've always known how to deal with viruses and bacteria, airborne, and so forth. So just a few changes that, slowly as we learned more about the virus, got more information about it. So basically what we had to do, apart from the PPEs and all the, precautions we had to take. For instance, in the waiting room, appointments were spread out, magazines and, entertainment things were all removed from the waiting room. We've had patients also that refused to wait, for instance, in the waiting room and actually wait in their car before entering the room. I've also seen a trend in, longer appointments because people would rather finish most of their dental treatments than come in multiple times for short appointments. Also, for instance, before the patient comes in, we tend to pre-screen them on the phone. They come in, of course, as you've seen in almost everywhere, temperature checks are being taken, hand sanitization. Again, the patients are being seated apart. Even for people who want to come in with, let's say their child, an older child with their parents, or someone for support during a dental procedure, we try to avoid that. I mean, I've had someone go on, someone supporting them through Zoom. So again, we got to get creative. Other than that, I mean, I'm sure both Dr. Muhammad and Dr. Majid are going to elaborate on this, but of course there's been more PPEs as well. And maybe I'll let someone else take over because there's a lot that we've taken.
Sorry, Dr. Muhammad, do you want to continue the point?
No, I totally agree with Dr. Layal. Just to emphasize on what Dr. Majid said earlier. Yes, it's a new virus. Yes, we are trying still to know more about it. Airborne viruses are something we're not very familiar with. But also what Dr. Layal said is that what I started with, we were already trained. For example, back in school, they always told us, treat every patient like he had a viral infection, like he had tuberculosis, like he had a major disease to protect yourself. So we know that. It's not that now, it's there, it's happening. So we are actually very careful about it. And sorry, I think there's some, yeah. And also we have a lot of new machines that are introduced into the market, some protective measures that would also help us, especially with the airborne diseases. So that's pretty much it, yeah. And the precautions with the patients, everything in general, is something it's not just us who are taking good care. Also, the patients are very well aware and educated about how to take good care of themselves during the visit.
Absolutely. So would you say that this sort of situation, Dr. Majid, has had an impact on provisional dental services at this point? And will this impact be a good thing or a bad thing? Will that be positive or negative?
I mean, you have to look at it from public point of view. We are doing what we're doing because we want everybody who comes to us as a patient to be in good health and so on. So the interruption of care was a problem, but now, coming back to providing that same care, hopefully most of these issues are going to be reversible and things are going to be corrected. So what happened, as the interruption portion of what happened, that was not good for anybody. Now, what happened after and how we are dealing with these things is going to be great for everybody. And this is because of all the things that we applied in dentistry. For example, the PPEs that Dr. Layal was talking about. Now we stepped up the masks. We're using different type of masks. They are more like N95 masks. We are using face shields. And when we were early on in phase 1 and phase 2 of reopening, we were dressed up in complete suits for protection from that virus. So a lot of these things that we adopted are here to stay. We are going to that filtration system is changed for good, and that's going to be there. So that's a great thing, because it's not only going to affect the COVID virus. I mean, this will be gone hopefully, and we all pray that it will be gone in a year or so. This is going to help with everything else as well. It will help with bacterial issues. It will help with other viruses, influenza A, influenza B, any type of virus. Now that filtration is going to help, and the UVC in the air ducts is going to help. And again, these robots that we invested, we didn't just buy them and spend a good deal of money just for the COVID. And we all know, and hopefully, that this COVID is going to go away, if not in 6 months, in a year. These robots that use the UVC and go and disinfect the whole office are going to help with everything, not just the COVID matter. It will help with the influenza, it will help with bacteria, with fungal, with everything. So of course, with all these things are going to be better for everybody, for patients, for staff, for us, if we learned a lesson from this. And a lot of these things are here to stay.
Absolutely. That is one thing I do definitely agree with. People do say that COVID is here to stay, and the way people have been just more cautious and careful with wearing the masks, using sanitizers more often, is something that is going to continue even after perhaps the vaccination is out. Dr. Layal, coming to you now, from both practice as well as a management point of view, what are the key challenges that this industry is facing? And let's not just talk about COVID, moving away from the whole COVID situation, what were the primary challenges?
Like I started earlier, it just I find, especially that I've worked in Canada for a while, and then now that I've recently moved here, I find maybe here this part of the world as well as international, globally, I guess I can say, is that there has to be more of a prevention approach. Again, I find that today everyone's got their smartphone. The access to information is very easy, and I find there isn't a lot of information about preventative care. Again, as I mentioned earlier, a lot of dentistry tends to be treatment focused. There's not enough oral health education out there, so I really think that there has to be more effort in making the patient more responsible and more proactive about their health. So I think this is one challenge that we definitely need to learn from this experience, and it has been coming and always. I see that it's a very big thing that needs to be tackled. Another thing, again, we described before, is that there is an inequality in access to care, which I find needs to be dealt with. Dentistry in some places tends to be very expensive, which can be a deterrent to many people, and especially now, given a lot of people have become unemployed. There's been massive salary reductions as well. So that also needs to be tackled. It just, and when I say tackle, it's not necessarily just the dental practice and the dental practitioners, but more at the national level, the policy makers that, there has to be more of a, oral health guidelines, more oral health protocols that can be shared, more standardized care among practitioners in order just to facilitate access.
Sure. Then, Dr. Mohammed, coming to you, how can dentists, pharmacists, and other arms of the medical profession work together in achieving what Dr. Layal has just said? That's one side of things. And the second side of things is from the government point of view, from the regulatory bodies. What more can be done to support this industry?
Okay. First of all, I think it's just about, at this point, let's put the first part of the COVID aside, but at this point, I think reassurance is very important for the patients. A lot of patients are still living in the same time zone of, February and January when Corona first started. At this point, I think we must, all of us in the medical industry, we must take our patients behind the scenes with your social media, with your marketing skills, with whatever you can show and expose. For example, for us, we make sure that we show our patients how we're sterilizing our instruments, take them into our sterilization rooms, show them between patients what happens, the procedures, make sure that they see all of those procedures taken when they actually come to the clinic, pass through the sterilization gate, they get their stuff sterilized before they walk into the waiting area. When they see those precautions are being taken, whether they're in the clinic or they're seeing you do that over social media, it will also give them, get them a bit into the comfort zone for them to start getting treated again. And of course, when it comes to the collaboration between all the physicians and practitioners in the medical industry, it's a matter of the usual case, the referral, informing the patients that it's okay, and making sure that every patient is getting his treatment done at the right place with the right specialist. So it's pretty much the classic routine that we had previously in collaboration with everyone. But again, precaution, prevention, and to the new method of dentistry or the medical market.
So then, I think Dr. Layal mentioned earlier that she wouldn't want a dental clinic to be within a broader hospital framework. What are your thoughts on it, Dr. Mohammed?
Sorry, she said what?
She mentioned, can you hear me now?
Cutting off a bit, there was some echo.
Right, I'll try and speak slower now. Dr. Layal mentioned earlier that she wouldn't want a dental clinic or one of the dental arms to be within a broader hospital framework. What exactly are your thoughts on it?
I mean, as long as the right precautions are being taken, then it's not an issue. The good part of this is that the patient would have everything under one roof. They don't have to go from one place to another and get exposed to different facilities. So they can get everything needed in the same practice or in the same facility. However, on the other hand, as she mentioned, that having a dental clinic and the hospital, already the hospital might have a lot of different cases. Their environment is kind of more exposed to pathogens and infections than dental offices. So that might be a bit of a risk, but if everything is under control, well managed in different separate departments, then I think it would be actually a helpful facility for the patients.
Sure, and the broader idea I get from this conversation we've had for the last half an hour or so is that all three of you all are very optimistic about dentistry in general and the future of the profession, which is great. But just talking about one particular arm of it, which is cosmetic treatments, what do you think about that, Dr. Majid? Do you think the future of cosmetic treatments, at least in the near future, is bleak given the conditions and situation right now?
I think in the very near future, the next 3-4 months, yes, perhaps a lot of people are trying or will be probably deferring elective dental work and things like that for later on. But again, what Mohammed was saying about communicating with your patients and showing them and the reassurance of the environment that you created and how you handle everything, we put big emphasis on displaying what is it we did. Even when you walk into the office, you do see the changes that are done. Actually, these robots are, as you walk into the office, they are there showing people. All this is to give patients the assurance that things are being handled in a serious matter here, and we are dealing with this as a serious situation. But dentistry in general is going to be just fine. We just have it's winter soon here in the US, and with the flu season as well, combining this with what I think is the second wave that's happening now, we will have difficult 3-4 months. But once we pass through that, and then the vaccine or a very reliable vaccine is out, and now I see Dubai and the United Arab Emirates started the vaccine there. Once everybody gets into that, I think everybody will just forget about all what happened. Human being, we tend to forget, and we move on and into other challenges.
Exactly. This is one conversation we've also had. Everyone keeps talking about the new normal, but we don't know how fragile that new normal is. We almost always prefer the old normal, and we might just go back to it. But at this point, Dr. Majid, to you again, you did speak about robotics within this sphere. We've also seen 3D printing playing a huge role in the whole dental sector. Do you think all of these advancements are actually going to accelerate the industry, and that could be a push that the industry needs right now?
A lot of, I mean, this as well had pushed us to adopt new technologies. So, for example, these robots, the virtual consults that we were doing for aesthetic reasons, we switched the platform a little bit and we made it adapt to emergency situations. Now, a lot of times we need x-rays in dentistry, like Mohammed was saying, and you cannot do full diagnosis just with virtual, but you do the very best that you can with virtual consult. Again, we brought a robot for a virtual consult, so it will be kind of more or closer to the environment of, you know, coming to a dental office versus just doing it over Zoom or FaceTime and so on. And you know, the 3D printing that you touched on, that we used from prior and so on. But yes, now, I mean, no good dental office and no good dentist is going to spare anything available to, you know, for technology-wise to adapt to the new era that we are going to go through after this.